Do you ever wonder why some medicines say take with food, while others say on an empty stomach only? The timing isn't random. It can change how well your medicine works, how quickly it's absorbed, and whether you'll feel side effects. So let's break this down in 5 steps. Number 1, why timing matters. The timing of when you take your medicine can be just as important as the medicine itself. Food affects absorption, side effects, and sometimes even whether the medicine works at all. Number 2, why some medicines must be taken on an empty stomach. And here's why. There's better absorption. Levothyroxine for thyroid conditions is absorbed best with plain water before food. Eating reduces how much your body takes in. And semaglutide, a newer diabetes medicine, must also be taken at least 30 minutes before food, drink, or other medicines with plain water only. Also, to avoid food interactions, for example, some antibiotics like ciprofloxacin or doxycycline shouldn't be taken with dairy products, milk, yogurt, or cheese because the calcium binds to the drug and blocks absorption. And finally, faster action is needed. A few medicines are designed to act quickly, and food slows this down. That's why they need to be taken on an empty stomach. So this leads to number 3, why some medicines should be taken with or after food. And this is because some medicines work better or feel better when taken with food. For example, when protecting the stomach lining, iron supplements often cause nausea, and food helps reduce this. Allopurinol, used for gout, is best taken after food to prevent a stomach upset. And aspirin can irritate the stomach lining if taken without food. Another point is enhanced absorption. Some medicines need fats in food to be absorbed properly. This includes certain antimalarial and antiparasitic drugs. And also managing blood sugar. So some diabetes medicines are taken with meals, and this is to prevent dangerous drops in blood sugar. And finally, reducing nausea. Some medicines, like some antidepressants and certain antibiotics, are better tolerated with food. And number 4, foods to avoid with medicines. Now, some foods and drinks don't mix well with medicines, and here's the key ones to know. Dairy products do block absorption of ciprofloxacin, doxycycline, and iron supplements. Grapefruit juice can dangerously increase levels of certain drugs like statins to lower cholesterol, and some blood pressure medicines like verapamil and anti-anxiety medicines. High fiber foods can interfere with thyroid medicines like levothyroxine and some antidepressants. And alcohol can worsen side effects or interfere with many drugs, especially pain medicines, sedatives, and antidepressants. I do have a video where I talk about this in more detail, and I'll leave a link for this below. And caffeine can affect how medicines are absorbed or broken down. For example, propranolol, verapamil, and warfarin can all be impacted by caffeine, leading to stronger or unpredictable effects. And number 5, safer food pairings. If you're unsure what's safe, plain crackers, toast, or non-acidic fruits like bananas are generally gentle options, but always check the label, and when in doubt, ask a healthcare professional. So in short, some medicines need an empty stomach for absorption, others need food for protection or better absorption, and certain foods can interfere with how they work. So in the next video, I'll answer another common question. Why do some medicines make you feel drowsy? Subscribe so you don't miss it, and drop your questions in the comments below. I may feature yours in a future episode. I'll also leave video links if you want to learn more about particular medications I mentioned in this video. Thank you for watching and take care.